Let's talk about hospital stay after pediatric orthopedic surgery. So we'll talk about the length of stay after your child has had surgery, particularly pediatric orthopedic surgery. So hi there, welcome back to Little Growing Bones. If your child is scheduled for orthopedic surgery, one of the first questions that parents always want to know is how long will I be in hospital? So in this video, we'll talk about what to expect during your child's hospital stay after surgery, how many days they may be there, what happens during that time while they're in hospital, and how can you help make the experience smoother for both the child and yourself. So how many days will my child be in the hospital after surgery? So the number of days that your child stays in hospital does depend on the kind of surgery they're having. So here's a general idea. Minor procedures like a simple tendon transfer or hardware removal, those are typically same-day discharges, or child might have an overnight stay if they need a close observation. For moderate surgeries, things like hip surgeries or fracture fixations, they usually stay for about 2 to 3 days. For much more complex surgeries like spine surgery or major reconstructions, a stay of 5 days or longer can be expected. So the stay in hospital may depend on whether the child needs to be admitted in an ICU, high intensive units, after surgery, and that normally means that they have to stay around for a slightly longer time. Every child is different. So some recover quickly, others need a bit more time, and that is okay. Your child's care team will typically keep you updated daily on what is going on and what to expect. You can also check out this video here for parents on how to prep your child for orthopedic surgery, so you can just be in the know of what to do. So now back to this video, let's talk about what happens during the hospital stay. So let's break it down. After surgery, your child will be taken to the recovery area, and then they'll be moved to a hospital room once they are stable. The key things that happen while they're there is one, pain management. So the first priority is making sure your child is comfortable and pain-free. They'll receive pain medication either through an IV, by mouth, or by other means, depending on the kind of surgery they've had and what they can tolerate. The other thing that's done is monitoring and checking of their vital signs and other parameters. So doctors and nurses will usually check your child's vital signs, particularly make sure that everything is going on okay. They'll check things like temperature, blood pressure, check the surgical site if it's healing on well and not having anything unusual happening to it. What about eating and drinking? So some children could feel nauseous after surgery, so food and drinks are reintroduced very slowly. They'll typically start with sips of water or clear fluids, and then gradually go on to soft foods. How about movement? So movement is an important parameter as well. In many cases, your child will start moving the same day or the next day after surgery. This depends on the kind of surgery they have done and the kind of restrictions that the doctor has put in place. A physiotherapist may come in to help you sit up, walk, or begin some gentle exercises, and this is important for the healing. Again, remember, not every child starts walking immediately. And this permission should come from your medical care team. How about parent involvement in the care of the child? So as a parent, you'll be right there. You're the source of comfort. You're there to help your child with meals or just being there as a calming presence. So your support makes such a huge difference in the healing of the child. So to the final question, when can we go home? So back to that important question. When do you get to go home after surgery? So your child can usually go home when, one, they can eat and drink without problem. Two, if the pain is under control with oral medication. And the third one is if there is no signs of complication. So they can also be allowed home if they've started to move safely, even just a little, if this is accepted, that is. What are a few things to know before you leave the hospital? So before discharge, your care team will give you instructions about the pain medication, how to take care of the wound or a cast if the child has a cast on, what activities are accepted and what limitations are there on the activities, when to have the follow-up, and what signs to watch out for while at home, particularly the danger signs that we talked about earlier. So make sure you ask the questions and feel comfortable with the instructions that you're being given. Don't rush this. It's okay for you to take your time. Here are a few final tips for parents. Before you go to the hospital, make sure you pack some comfort items. Get them their favorite toy, get a book, get a blanket for yourself or your child. Bring some snacks or chargers for yourself. Don't hesitate to ask for help from the nurses, from anyone who can render the help at the hospital. And rest when your child rests. It helps to stay strong as taking care of the child. So the hospital stay is just part of the journey. With good preparation and the right support, you'll get through it very smoothly. So if you found this video helpful, give it a thumbs up. Don't forget to subscribe and like, and check out our other videos on recovery and what to expect after pediatric orthopedic surgery. And don't forget that you are doing great and that you're not alone through this. And thank you for watching. Until next time, keep the live and grow bones.